What I'll do today is I'm gonna share my screen and share a presentation where I'm first gonna share a little bit about what Vitalism Foundation does and what Vitalism is, then discuss a few vectors into uh, data sharing, especially when it comes to Europe, and some vectors for political change as well. And then I'll open it up to questions. So without further ado, and thank you very much for that kind introduction, let me share my screen. All right, can everybody see?
Yes.
Fantastic. All right, so yes, very grateful to be here today with everybody. The title of the talk that was on the program was "Better Sharing of European Health Data: Proposal of Longevity Organizations." And I'll just say before I start this that there isn't very good data out there that summarizes this as a distinct thing. So there are some proposals, there are some people who talk about different initiatives, but I can't say that there is a very coherent or well disseminated a set of programs that have been worked on. At least I'm not aware of them. So let me jump right in, and we'll start. And by the way, if anybody knows better, by all means, please enlighten me. So as mentioned in the introduction, I'm a repeat founder, and in tech, I'm also technical myself and have a bit of background in bio. I studied neuroscience at university, and I've invested in a bunch of companies in everything from health in the here and now, supplements, diagnostics, companies that do more hardcore biotech. And then the last 2 years, came up with this idea of a movement and a philosophy that could really help change the game in the context of what Didier was talking about, our big need to somehow rally and how we could do that more effectively. And of course, you can also see my co-founder, Nathan, on this slide, who also started LBF and HealthSpan Capital. All right, so I'll start with this simple question. Is fighting aging and death humanity's #1 priority right now? Who thinks it is? Please raise your hand. I can't see you, but I can see some of the people on the Zoom. If you believe that it's humanity's #1 priority right now, please raise your hand. Okay, I don't
A
see any
lot
raised
of people
hands.
are raising their hands, but I'm not certain they are honest.
Okay, a lot are. Well, this is a bit of a trick question because it seems like it. We spend about 30 or 40% of the US federal budget on aging. We do it through Medicare, Social Security, and other costs of aging directly. So it is actually quite fair to say that humanity is fighting very, very hard, incredibly hard. So hard that maybe we could cut almost all of our income taxes if we didn't have to pay for aging. So it's commonly, I think, misunderstood that this point. The problem is not that we're fighting hard, not hard, excuse me, that we're not fighting hard. It's that we are fighting wrong. And the mainstream tells us that we're already doing our best. So, in other words, what we're competing with is the fact that the sources of authority, prestige, influence in society are saying that the current system is the best we can strive for. The medical systems, the symptom suppression, essentially playing whack-a-mole with these so-called diseases of aging is the best that we can do. And so we spend all these trillions of dollars, but as probably most people who are attending this event realize, we're not getting very much bang for our buck, right? So this is fundamentally not a sensible thing to do outside of the moral question of letting people age and die. So what is vitalism and why is it necessary? The definition we use is the movement to solve aging and death through investment in science and technology. So in other words, it's a perspective about how we address this problem. And we have a discrete goal, which is getting 1% of global GDP to solve the problem. Now, many in the audience may already know that countries, for example, in Europe, many upper income countries spend about 8 to, in the US, 17% of their GDP on healthcare. And most of that so-called healthcare is actually sick care, which is all about symptom suppression and dealing with these kind of pathologies when they've already expressed themselves in an acute way. And so 1% of GDP for any specific country should actually be a no-brainer, right? You're not taking that much away. And the vitalist perspective isn't to say, okay, we're just going to abandon everybody who has some pathology Of course, that, suffering matters too, and we should try to save everybody who's suffering from a pathology to the degree that we can. But we are saying that the ratio of resource allocation should not be what it is today. We're in this kind of insanity in the way that we distribute resources. And the current situation, unfortunately, is that there are almost no resources for science and technology, which is directed towards aging. There's hardly any plan or coordination. And I have to, tip my hat to Ilya and Didier and folks who've been with the International Longevity Association and folks who have been trying to build up coordination. But so far, the results I would say that all of us have achieved are limited, and we need much more coordination. And so part of that is identifying each other, figuring out who wants to achieve this common goal, and aligning and having more of this cartilage to coordinate, to work together, to have a common name for what we were trying to achieve. And that's why we came up with Vitalism. That was one of the principal reasons that we felt we needed a new name that people could rally around. And I'll just speak briefly to what Vitalism does in a moment. So to identify one another, we created this declaration, which is a codification of the ideas that we share with many and makes it easier to find one another, right? Because as probably many of you in the audience know, the term longevity and anti-aging, both of those terms have been, let's say, taken over or corrupted by various influences, right? You meet somebody and they say they're into longevity, and then you find out that what they mean is that they take a multivitamin and they do cold plunges because they heard on Huberman that that's what they need to do, or they're following Brian Johnson's erection, and that makes them into longevity. And with anti-aging, of course, we know that we have other problems with the cosmetics industry that's appropriated that term for their own purposes. So we needed some term which is distinct and has a meaning that can be used. Now, vitalism as a movement has a specific theory of change. The theory of change that we have is that if we coordinate, meaning more people self-identify as vitalists, help one another, elevate each other's efforts, whether they be companies, nonprofit initiatives, or others, we can actually achieve very substantial leverage economically and politically to eventually get to that 1% number of GDP. And that can happen in various ways. It could happen in getting people in positions in government, whether they be at the NIA or program directors at ARPA-H who command $100 million per tenure each. We already have a couple of vitalists in those roles, and we've only been around for a year or so. And it could also be just starting companies or other initiatives that produce goods and services, just like Starlink is a mechanism for SpaceX to reach Mars. And so we're working on these things. And of course, if anybody relates and aligns and isn't yet signed up, go to vitalism.io and just sign up with your email. It's free. Of course, you can do more than that, but you should absolutely be part of the community. Okay, so a few words briefly on some of the working groups that we have, some of the things that the community is doing in the foundation. One is looking at geo-arbitrage. So understanding how in different jurisdictions, different states, different countries, different special economic zones, we have different rules. And that means therapies can be developed, studies can be done under different timelines and regulations. Another area we're doing research in is high net worth individual psychology. So we're trying to understand the billionaire paradox. Why is it that people who are very high net worth and have nothing that they can't buy except time don't spend more energy, attention, capital into this, whether philanthropically or as an investment? To our knowledge, there's been no large-scale systematic review of this. And so, by the way, if anybody from any organization, Ilya, Didier, and others want to collaborate on this, let's talk about it. We definitely want to enhance the scope and make this, to the degree that we can, a public good. And then researching longevity states, so understanding how different jurisdictions might move to that 1% GDP goal, et cetera. And now I'll move to the part of my presentation, which is around data sharing. And I'll start with this. Didier mentioned Manhattan Project or Apollo program. And the Apollo program is a great example because it was done in peace time, generally speaking, even though there was a Cold War at the time. And at the time, the US spent about 0.5% of GDP, which in today's terms would be $120 billion a year. And there were 400,000 people involved in the project. Now, I would challenge us to think, imagine if during the Apollo program, these departments, material science, propellant technologies, aerodynamics, heat shielding, et cetera, couldn't or refused to fully transparently share data with one another. Just imagine how absurd that would be. You couldn't even make the first step, let alone build a successful rocket or moon mission. And unfortunately, in many senses, I think that's where we are with our data sharing situation. There are many silos. It's very hard to gain access, et cetera. And so I'll speak about a few things today. One is encouraging open access. Another is consolidating and streamlining data sharing. And the third is decentralized data aggregation and incentives, different incentives. And with some highlight to Europe, of course. So changes in open access. Maybe an interesting place to start is that in the EU, from my research, 83% of papers are open access, whereas in the US, it's only 45 to 50%. The US is the biggest funder of biomedical research in the world by far. And so, of course, this is the problem. But it's not just the publications that are important, but also the data. And the data is typically not shared, not to speak of the fact that researchers are not incentivized to share negative results at all. And so we have all this very useful data, which is just hiding. And I'm not even speaking about, a researcher who, for example, is doing single cell analysis or collecting different omics data, proteomics, metabolomics, et cetera, and has useful data, which could really save time for our common effort against this problem, and really has no incentive to share it right now, and would never share it, partially because it might contribute to a future publication that that researcher is working on, partially for other reasons. Maybe they might want to consider spinning out an entity based on this, et cetera. There are all sorts of reasons, but those reasons become problems when we think about the general progress that we all want. One thing worth mentioning is Research Hub. I don't know if that was mentioned before. So that is a platform for to encourage open access. It's a open access publication platform. It also has a cryptographic coin. It was founded by Brian Armstrong and Patrick Joyce, and that coin now has a market cap of $53 million. I'm sure many here are aware of the crypto boom that is happening now after the recent election in the US. But the interesting thing about Research Hub is that the structure incentivizes better behaviors. So peer reviewers get paid with this coin. They have an incentive for the system to grow, because if network effects take hold, then the value of the coin will go up, which is an inherent motivation. And you can imagine that Research Hub would also incentivize people to share other things like negative data or other data, et cetera, et cetera. So you create an ecosystem, which is a positive ecosystem. Moving on, the next point here is consolidating and streamlining shared data. So that could be from biobanks, but also from other sources. So I want to mention a few points on this. So one is cataloging. And this is a problem that Vitalis Foundation would like to make progress on. We have it on our roadmap, although we haven't gotten very far yet. And the idea here is that there isn't a great resource which just simply catalogs everything that's out there in a meaningful, helpful, great UI way, which streamlines and makes it easy to engage with what is out there. And then when you dive into the different components, when you try to get data, there's the access authorization, where there are different requirements in different jurisdictions. Certainly in Europe, that's true. Finland has a big biobank. UK has a big biobank, which recently changed its regulations to much uproar, because it made the ability to download impossible and reduce the ability to analyze some of the data and use it. There was a public letter with 100 signatories about that topic. Many of you probably know. And of course, these different data sources are typically not data normalized or standardized, and sometimes they're cost to access them. And not to speak of the need for effective anonymization. So one big problem, and this is certainly true in Europe, is that there's a lot of concern around privacy. And so what a lot of this data is considered to be legally is pseudonymous, because the belief, and perhaps justifiably in most cases, is that with enough other supportive data, the people involved could actually be discovered. And so there's actually a need for some sort of anonymization protocol and system which would allay those concerns in a more effective way. And I think it's plausible to do something like that. And also referring to what was mentioned in the previous talk, I think AI could be quite useful for this, and maybe abstract or obscure some things. So those are some key factors and needs. And then I'll just mention decentralized data aggregation and incentivization. I think this is really fascinating. So the first point here is the DeSci spring. So I suspect many here already know about VitaDAO and these other DAOs, the notion of IP NFTs, HairDAO, CryoDAO, HydroDAO. What many here may not know, or maybe do know, is that a lot of these DAOs are started by or located in Europe. And that is quite ironic, because it's a decentralized movement which has inputs from everywhere, but a lot of the key people involved in it are in fact European and operating from within Europe, which has certain bureaucratic hurdles in general. Now, it's ironic because, of course, the U.S., which typically has more of a laissez-faire free market access to different health services and goods, has been so reluctant to allow crypto. And so, Europe actually has been the birthplace of I think, a lot of leadership in this. Now, a lot of these DAOs and DeSci models have some novel mechanisms that are worth mentioning. So, for example, HairDAO is a DAO to develop in a verticalized fashion hair growth products. And so they intend to develop the IP in-house based on their community and then sell those products. And one of the things that they also intend to do is compensate people in return for submitting their data after using the products. Now, I'm starting to lose my hair. I'm sure some people have either lost their hair or are losing their hair. And you may have seen these websites which always show you the positive results, but never all the rest of the results. And so one of the big things about these DAOs is that, and the culture of blockchain efforts, is the transparency. And so I think we may see quite a lot more of that. But in this context, it's unfortunate to mention that there are countervailing forces which make it more difficult for individual agency and liberty around one's data. In the US, there's a challenge with EMR openness, and there's a lot of clunkiness to ask for every doctor or hospital to get your data. In Europe, you have some countries which prohibit private access to diagnostics. Everything must happen through the medical system. So this is a feature of, let's say, more of a regulatorily protective governance style, which says, okay, well, if somebody gets a genetic test, which in France you can't get without medical supervision, and in Germany and elsewhere also, you need a referral from a licensed medical practitioner and maybe a consultation when you receive your genetic analysis results. Whereas, in the US, you can just get a whole genome sequencing basically whenever you want for a few $100s, and then you get the results and do whatever you want with them. Of course, there's a protective aspect to this for these individuals, but on the other hand, that really hampers the agency and the ability of these individuals to participate in the decentralized data sharing. And decentralized data sharing in general is just a major trend and hopefully a mechanism by which we can break through and collect data in parallel to standardizing and kind of streamlining access to more traditional data sources. One example to mention here is Biohacker DAO, which just raised about $1.3 million on a juice box campaign, also a crypto for its project. And there you essentially have these biohackers who who run self-experiments and then submit their data. And that data is then shared and they can be rewarded with token. But just to add one point on the private data ecosystem, I think the challenge when you think about prescriptive policy proposals is that in single payer health systems, so public healthcare, there's on the one hand a tendency to be more protective and in some sense controlling, so thereby limiting or handicapping the ability of individuals to participate in these kind of data ecosystems. And on the other hand, even if there isn't an explicit initiative of that type, which hampers people's ability to get their data, or to initiate certain tests on their own, there's a problem in the incentive structure for private ecosystems. So, I have many friends in Germany, and in Germany, many people would never consider going and paying for a blood test because they expect everything to be free. And so their immediate thought is, well, I can just get something from my doctor, but they would never consider that, what the doctor is prescribing them may not actually be the latest and greatest in what is possible in terms of biomarkers, even for, things like more detailed lipid panels and other things like that. Which in many countries in Europe, you do need a referral or a prescription to get. And that may not be easy because the doctor who is trying to, protect the national treasury in a way, of course, that's not their direct motivation, but will be hesitant to prescribe something unless there is what they believe a medical need. And the medical need, unfortunately, because the entire world is trapped in a sick care construct, is related to an acute situation. And so because of that, it's very hard sometimes to get some of these referrals, and that really reduces access to data. So one important thing that could be changed is having a bit of a liberalization where each jurisdiction does make it possible for individuals to get these tests, and opens the market and maybe encourages some private innovation in these spaces so that companies can emerge that are offering more data and giving more license and agency to individuals, because individuals, if they had more optionality on the market, I believe would get more diagnostics and would also share their data and create a more vibrant and I think evolving ecosystem. So that's the final thing on that. I'll just mention an event that we're running very briefly. So next April and May, we're creating a longevity zone, which is the biggest and first of the first zone of its kind, and the biggest event that we believe has ever been in the Bay Area, maybe in the world. It's essentially a 2-month long event where every vector associated with longevity is going to converge. During those 8 weeks, there'll be a place where there'll be around 70 permanent residents and up to 1,000 people per conference and thematic week. And there are these themes that you see on the slide that cover everything from design network states to longevity science to what you can do in the here and now, clinics and health optimization, frontier technologies, AI and biology, which of course the Bay Area is perfect for, investors and startups, and advocacy and policy. And the reason I mention this is because I do think that we're at an inflection point where these topics are starting to converge and there's more awareness. And it's a big opportunity to get leverage from that. And that's it for me. Just as a conclusion, if you're interested in what Vitalism is up to and you align, please sign up. If you'd like to come to the event, go to vitalistbay.com, and I'd be happy to answer and discuss any of these topics. And feel free to reach out directly to me at adam@vitalism.io. Thank you.
Okay, thank you, Adam, for this lecture. And I open up for questions. Are there any questions in the room? Nobody? Oh, wait.
Adam, what help are you particularly hoping that people will give you to grow the Vitalist community and make it have more impact?
Yeah, what would help me grow? Was that the question?
Yes.
I'll come closer to the mic. Yeah, Adam, what are you hoping people will be able to give you that will allow you to grow the Vitalist movement more and to have more impact and the goals you've got in mind? What are you looking for?
Yeah, thank you. So I think there are two key levers right now. One is capital. So of course, any donation or anybody who signs up to be a active member, which we call mobilized vitalists, there are some dues because we've always wanted to be financially independent. So we don't want to rely on donations, but of course, donations are a very strong lever. So if anybody is interested in this and wants to support any of these efforts that we work on, that can be done on the website or reach out to me directly. And no less importantly, skilled people who want to either join the team or help lead one of the initiatives that we have working, or who want to contribute in a specific vector. So, for example, recently we had somebody join who is helping with PR and marketing and communications. Who this person has done campaigns for Estee Lauder and top brands worldwide, and she's been incredibly helpful. If people have distinct skills that they would like to contribute, either voluntarily or for some compensation, although we're not very wealthy, so it would be limited, then that would also be very relevant.